Welcome to the deep dive. Today we're really digging into addiction, but maybe from a different angle than usual. We're looking at the root cause, and our sources strongly suggest a link to unresolved trauma, specifically childhood sexual trauma.
Exactly. And what's really striking, almost counterintuitive, is this idea that addiction itself often isn't the core problem. It's more like, well, a solution that started to help someone cope with deep pain, often from childhood, but then it just stopped working. It became its own problem.
Okay, let's unpack this for you listening. We want to get past the surface level here. We'll explore how that early trauma can actually physically rewire your nervous system. And then what a real path towards permanent healing might look like. Not just sobriety, but real peace.
So when we look at childhood sexual trauma, or CST, and how it fuels addiction, it's not just about emotional pain, though that's huge. It literally changes the developing brain, the heart connections, the whole nervous system that kind of sets the body's baseline to danger. You get these really damaging core beliefs forming, like love means danger, or being vulnerable leads to shame. Safety just feels non-existent.
And those beliefs formed so early create these massive emotional wounds, right? Wounds the adult then tries to cover up. You see things like dissociation, that feeling of being disconnected from your body, from your feelings, or just this deep crippling shame,
Right.
powerlessness, addiction, whether it's substances or maybe workaholism, even constant worrying. It acts like a temporary painkiller for all that anxiety and chaos inside.
A temporary anesthetic. And that's why just talking about it isn't always enough. We have to look at the neuroscience. Trauma doesn't just live in our stories or memories. It gets stored physically in the body, in the nervous system. You know that saying, the body remembers what the mind wants to forget? That's key here.
Right. And here's where it gets really interesting for recovery. This focus on the body, the physiology. Because if the trauma is physically stored, then healing isn't just about understanding the past. It's about actively retraining the nervous system. You have to teach your body, literally teach it, that it's safe now, that the danger is over.
Exactly. And that retraining needs specific body-focused approaches. It often means going beyond just standard talk therapy. Sources point to things like trauma-focused therapy, maybe EMDR, eye movement desensitization and reprocessing. It helps the brain reprocess traumatic memories safely.
And also somatic healing, right?
Right.
Things like yoga, specific breath work, mindful movement. These aren't just for relaxation. They actually help regulate the nervous system, telling the brain you're safe, helping shift out of that constant fight or flight mode. Plus, things like group therapy, because connection breaks down that isolation trauma causes, and inner child work, learning self-compassion.
For healing to be permanent, lasting, it really needs to happen on multiple levels at once. Think of it in three parts. First, there's the mind. That's about understanding the trauma, the science behind it, reframing the narrative, and truly getting that it wasn't your fault.
Okay, the mind. Then second is the body. Using those grounding techniques, movement, breath work we mentioned, basically communicating safety directly to the body, helping you feel okay in your own skin again.
And third, perhaps the anchor for long-term recovery, is the soul. This is about finding meaning again. Purpose, creativity, connection, rediscovering who you are beyond the trauma story. When that deep pain addiction was trying to manage, finds healing and purpose, the addiction often loses its power. Its job is done.
So what does this all mean for you listening? Healing isn't about forgetting. It's more like learning to remember safely, integrating the past without letting it define you, and reclaiming those parts of yourself that got silenced by fear or shame.
Yeah. Permanent recovery, true recovery. It comes from consistent self-compassion, from setting boundaries, from accepting what happened without judgment, making that choice to seek help, to gently face the pain. That's really where addiction starts to lose its hold and healing begins. It's a journey.
And remember, if you or someone you know is going through this, healing doesn't happen overnight. But it is possible. It becomes inevitable, really, when compassion leads the way. You are not your past. You are the courage that survived it.